Hi, I'm Dr. Rakesh Sarkar, consultant cardiologist and electrophysiologist presently working in BMB Birla Heart Research Center. Today I'm going to speak on the topic which is very pertinent to the present scenario, that is seasonal affective disorder and the heart health. Now, as we all know that affective disorders or the affective problems are related or associated with some cardiovascular disorder or cardiovascular problems, and this is well established entity nowadays. With the seasonal changes, there is some variation of the intensity or the prevalence of the affective disorder, which has been seen in many of the studies, and it is nowadays playing a major role which is contributing for cardiovascular diseases and their occurrences. Now, what are the cardiovascular problems which we encounter or we often see to occur as a result of the seasonal variation of these affective disorders? These are mostly or predominantly the coronary artery diseases and acute coronary syndromes, followed by different arrhythmias, sudden cardiac death, and last but not the least, pulmonary embolism or some aortic dissection. And last but not the least, CVA or cerebrovascular stroke, which is a shared zone between neurological and cardiological entity. Now, why this thing happens? As we all know that the affective disorders or the fluctuation of the mood, which is responsible for either some anxiety or sometimes some depression, which is cumulatively known as affective disorder, which is not actually within the normal physiological or psychological limit. We often coin it as affective disorder, and it is often related to some excess hormonal secretion in the body, which can translate in some cardiovascular events like some vasoconstrictors like endothelin, cortisol, or norepinephrine, or otherwise some neurotransmitters like serotonin are often responsible for their erratic secretion in the body just because of these affective disorders, and these are mostly related or seen at the time of fall or winter, which is reality. As we know that with the affective disorder, this is not only the physiological things which is responsible for occurrence of all the cardiovascular events, rather there are some associated factors which comes in hand with the affective disorders. Like we can say that lack of our exercises, our sedentary lifestyle, adherence to some alcohol or smoking, which is often found in case of depression. At the same time, lack of adherence to the medicines. And last but not the least, which I want to mention, that is some depressive components, which itself is responsible for emotional outburst, sometimes can result in some cardiovascular events. And henceforth, it is very important to understand that with the advent of the fall or winter, whosoever are in continuous monitoring or not actually having any previous cardiovascular disorders are basically requiring cardiovascular periodic checkup so that they can be little bit assured or just to avoid their futuristic cardiovascular events, not only with the physical evaluation but at the same time some mental evaluation is also required to avoid such situations. Thank you.